Empezó a agarrar picazón, soy todavía.
Not that other one.
Well, good morning, everyone. Thanks for being here. I'm Ed Gonzalez, the Harris County Sheriff, and this morning we're going to provide an update on the mumps outbreak inside our Harris County Jail. Obviously, when we operate such a large system, we always say it's a city within a city, and so for us, there's an array of things that we deal with every day, and this is another one that we're going to be dealing with. I noticed that in another state, New Jersey, they're actually going through the same thing at one of their corrections facility right now. So again, we're going to navigate through this and make sure that we take every precaution and have both short-term and long-term plans in place. And really want to thank the City of Houston for being our partner and helping us navigate through this. We're also working with Dr. Shaw with the Harris County Public Health Authority as well, and so they've also been informed and know kind of what's been transpiring. So again, the City of Houston has been a wonderful partner, and being that we're physically in the City of Houston, they're the lead agency that assists us with this, and we are privileged to have Dr. Peirce. He's the Public Health Authority with the City of Houston Health Department, and he's here to provide an update and to answer any questions. And we also have members here from our jail operations team. We have Chief Coleman, Major Summerlin, Deputy Gilliland. We have Chief Deputy Takika here as well. So, Dr. Peirce, thank you for being here.
Thank you, Sheriff Gonzalez. Thank you, everyone, for being here today. So the update is that we have the Sheriff's jails folks have identified 14 cases of folks who potentially would have contracted mumps. We now have confirmation in 7 of those because it requires some blood tests. They have to go out to the lab, and we now have the confirmation of 7, and the remaining are pending. The first case popped up in about mid-May, and then there was no new cases until just in the last week or so. And that fits exactly what we would expect with the natural incubation period of mumps. So mumps is a viral illness. It is not so easily transmitted. It's transmitted by what we call a droplet transmission. So if you're within about 3 feet of somebody while they're coughing or sneezing, that would be a way to contract it. If you are sharing a glass or a beverage, or you're sharing knives and forks with somebody where their saliva is on the fork, that would be a way to contract mumps. But simply walking past somebody or being in the same room with them if they're not coughing or sneezing would not be a way to contract mumps. So you have to be fairly close and somehow get a droplet, some of the respiratory droplets, into your airway system. Generally, mumps is a fairly mild illness. You're going to get fever, body aches, headache, fatigue, loss of appetite. The hallmark for mumps is a swelling of the parotid salivary glands, which sit here right in front of your ears in the back part of your jaw, and they swell up and they become very, very tender. And that's sort of the clinical diagnostic hallmark of mumps. Now, one of the things about mumps is that not everybody who's infected with mumps will get that, which means, they're going to just have the usual sort of viral symptoms of a headache and fever, body aches, so on and so forth. And therefore, someone may not suspect that they have mumps, and it would therefore likely go undiagnosed because, again, the illness, just like most viral illnesses, lasts maybe 10 days, maybe 2 weeks, and people generally recover. We get concerned about mumps because in a small percentage of patients, there are some serious complications that come with the mumps virus, and they include swelling and damage to the reproductive organs, the ovaries and the testes. And in some cases, that can result in sterility. There's also the complication that other organ systems can become infected, and we worry particularly about the brain itself and the meninges, which is the tissue that covers the brain, and they can become inflamed and react badly, and that can sometimes result in some serious complications. And of course, the other group that we worry most about are pregnant women, because the unborn child, if the mom is exposed, develops mumps. There are a whole variety of complications that could occur to the unborn child. So I bring that up because everyone needs to understand the importance of, well, mumps generally is a mild illness, so why is everybody getting excited? Because there are certain people in our society who are going to suffer greatly for it, and it is a vaccine-preventable illness. We can prevent this. We have the tools, and in fact, whether it be polio, measles, even the flu, these are all vaccine-preventable illnesses, and we've got a responsibility. When you vaccinate yourself or your child, you're not only protecting yourself or your child, you're protecting others in the community. So if you're a healthy person, and if your child is healthy, you may say, why do I need to bother about it, right? Well, a small percentage of otherwise healthy people will suffer serious complications of these viral illnesses, but not more importantly, but just as importantly, they are at risk for transmitting the virus to somebody who is at high risk and definitely will or is likely to suffer a serious consequence. So this is why we want to get ahead of the game. We want to stay on top of these illnesses and prevent the spread. So to the point of how do you do that? Once we have a situation like we have here in the jail, how do we get ahead of it? So it's the basic covenants of public health and disease control. I need to compliment the sheriff, your staff, and your medical staff in particular, because when we arrived here yesterday, we were so pleased to find out that they had already implemented many of the steps. And these are not necessarily easy. I'm not a jail specialist, but I understand that you have a complicated environment here for a variety of reasons that I've come to learn about in the last 24 hours. But the basic covenants are, number one, you need to isolate the people who have symptoms. That means you get them out of the population and treat them as necessary. We test them, but we keep them from spreading the illness to anyone else. But remember, you still have to house them, you still have to feed them, they still have to use the lavatory. There are activities of daily living that need to be addressed for the folks that are in isolation. In addition, you then need to quarantine the people who were exposed to them but do not yet have symptoms. So this would be the roommates or the other close contacts, people that they worked with. They need to be then quarantined, and they need to be quarantined for the entire incubation period. And with every virus, it's a little bit different. Mumps, we generally see the average incubation period before somebody develops symptoms is about 16 to 18 days, but it can be as much as 25 days. So imagine the challenge that the sheriff's office is going to have to deal with in terms of isolating those that are sick and then quarantining all of those that were in contact with those that we know have been sick, and you're going to have to do that for 25 days. So this is a real burden, but when we got here yesterday, they had already started doing that, and I think that's really commendable, and you should be proud of your staff. I know you're proud of them, but you should be extra proud of them for doing that. Let me just check my notes, see if there was something else I wanted to hit on. I think those were the things. So we talked about the virus, how it's transmitted. It's not necessarily easy. There are some serious complications to it. It is vaccine preventable. The disease control steps have already been implemented at the jail. We're continuing with testing of the remaining samples, but quite honestly, at this point, we will know for the benefit of those individuals what their tests are, but we've already got 7 out of the first test came back positive for mumps. So we know that that's what we're dealing with, is mumps. The rest of the folks are clinically symptomatic. So that is, in fact, what we're dealing with. I think those are the points I want to make sure.